The following portion of Studio 512 was sponsored by CPI Health. Capital Pain Institute offers comprehensive pain management services that are tailored to each and every patient that walks through the door. Dr. Andrew Phillips is here to tell us more today. And Dr. Phillips, I want to start with what comprehensive pain management actually means for someone who might be dealing with chronic pain.
Yes, so when we have patients coming through the door, we want to make sure that we figure out exactly what's going on. So sometimes that involves some investigation with some more imaging or about some other studies or tests. Also just taking into account that everyone's pain is a little bit different. So we also start things a little bit more conservatively, maybe some physical therapy, trying to find other ways to try to minimize pain medication and other types of medications.
All right, Dr. Phillips, what kind of conditions do you guys typically treat here at CPI?
Yes, so we treat a whole host of conditions and all types of pain. So we have muscle pains, we have joint pains that we see nerve pains, whether it's chronic, things like diabetic neuropathies in the feet we see a lot of the time as well. Things like complex regional pain syndrome is another condition that we see. We see most often a lot of stuff in the neck and the back as well.
Okay, all right. What's your advice to someone who actually thinks, yeah, I've just got to live with the pain? They might have even been told that by a doctor.
I hear that all the time, and the first thing I say to them is, you do not need to live with the pain. They come in here and they've learned to do their daily lives, but in a way that they're struggling. And there are just so many things that we can do to really help their pain. It can affect you physically, it can affect you mentally, it can affect you emotionally, it affects relationships, it affects mood. And to try to get to the source of the pain, you're able to help so many aspects of life, and you don't need to live with it.
All right, Dr. Phillips, what kind of advanced procedures does CPI offer for people who maybe haven't found relief through other treatments yet?
Right, so we have a whole host of things that we can do. So we typically start with the most conservative first, right? We want to do the least amount of stuff that's possible to give you the relief that you're looking for. So with that, once we figure out what's going on, things are like injections, right? Something like an epidural steroid injection, totally different than a pregnancy epidural, I promise you. It is very finessed and looking to try to reduce inflammation around nerves.
I did ask you earlier, and I'd like you to talk about this on camera, is basically, does someone need to know what's wrong with their back in order to walk through the door here?
They definitely do not. Really, when people hear about back pain, they hear about back pain from their family and their friends, and they're like, I have back pain, not you have back pain, you did this, I did this. The thing is, not one treatment is the same for everyone. So what our goal is, you come in the door, we will do everything possible to figure out what's going on.
Detectives as well as doctors,
Absolutely,
and big on teamwork.
Absolutely.
I really appreciate your time, Dr. Phillips. Thank you.
Thank you so much. I appreciate it.
Capital Pain Institute has multiple locations in the Austin area. Find the one nearest you at capitalpain.com. The preceding portion of Studio 512 was sponsored by CPI Health.